Hear what he's been saying.
Good morning. First, I just wanted to say a huge thank you to Royal Free and the whole team that looked after me. I've had world-class care, and I just want to say a big thank you, and also a big thank you to the RAF who did such a good job with my evacuation, and ultimately the government who decided to pick me up. Are there any questions?
Are there any questions? I'll take you one at a time. I'll start here.
What was it like when you were in that tent, knowing that you had a very serious infection?
Well, it was actually it was really busy, you know, especially for the first few days. There was lots going on. They were constantly doing my observations. I was having fluids and lots of blood tests, things like that. So it was really busy, actually, and I didn't have a lot of time to really ponder the full sort of the potential for the illness.
Can you describe what it was like being behind that sheet of plastic inside that tent, watching what was going on outside?
Yeah, it's a little bit strange. It's like, I suppose it's like being in a fish tank, in a way, but because it's all clear plastic around you, so it wasn't. I wouldn't say it was claustrophobic. It's strange. Everything goes on in that tiny little space. So there's not much privacy or anything like that. But all in all, yeah, you've got other things on your mind than the confines of the tent, really.
Okay, over here.
Lisa O'Carroll from The Guardian. Well done. Can you describe to us what having Ebola was like? I mean, what's happening in West Africa is devastating. You've got it. Can you tell us what the symptoms were like, how bad it was, how ill you were?
Yeah, well, I was very lucky in several ways. Firstly, in the standard of care that I received, which is a world apart from what people are receiving in West Africa at the moment, despite a lot of organisations' best efforts. So I had amazing care, which is one difference. The other difference to a lot of Ebola cases is that my symptoms never progressed to the worst stages of the disease. The people that I've seen dying horrible deaths, really. I had some unpleasant symptoms, but nothing compared to some of the worst of the disease, especially when people end up dying. I never had any vomiting, for example, which was nice. But a lot of people, especially those that go on to die, get vomiting.
What was the worst you got?
The worst, really, I had some pretty high temperatures at times for a few days. From the day I was evacuated, and the day before, and a couple of days when I was here, my temperature was really high, and that was very uncomfortable. I had sort of chills. I had some gastrointestinal symptoms as well, which weren't very pleasant, but again, nothing got as bad as the worst of the symptoms that I've seen from patients in West Africa.
Okay, thank you. Other.
Rami Jeffries, BBC News. Well, can you talk us through your decision to volunteer to go and work with Ebola patients and describe what the conditions were like in West Africa?
Yeah, well, I was in Sierra Leone anyway, working in Freetown, and so when it started back in early summer, when it really started picking up, obviously it was really big news in Sierra Leone, and everyone was frightened and concerned about it in the country, and so as far as a decision to go and work with Ebola, there wasn't a moment when I thought, I have to go and do this. It just, when it was something that, and still is, really sort of engulfing the country, and so it's not, I don't know, it didn't feel like a decision. It just felt you know, it was just natural because I was in a place to help, and yeah, it just felt like something that had to be done, really.
And you're abiding in memory of the people and the patients that you worked with there?
Well, that's William Pooley, a volunteer nurse who has been discharged from hospital in London after 10 days of successful treatment for the Ebola virus, which he contracted while working in Sierra Leone. He said he feels wonderfully lucky to have survived it. 47% of people who've contracted Ebola in the latest outbreak have died of the illness. So he was speaking of the amazing care he has received at the Royal Free in London.